That's really a huge challenge in what we're dealing with here in the US healthcare systems. I don't think that it's entirely broken. There isn't enough attention on prevention and social determinants of health. There's so much misinformation. No, you can't do this. Navigating the health system is so challenging. That early adoption can really make a difference.
Hi everyone, I'm super excited about our today's interview. We have an amazing guest. His name is Austin Chiang. Hi Austin.
Hi.
How are you doing?
Good, thanks for having me. I'm excited.
Yeah, let's start with a short intro. Please tell us a bit about your background.
Sure. I'm Austin Chiang. I'm a gastroenterologist, a physician by training. And so I've been practicing for a few years, but about a year and a half ago, I also stepped into the role of Chief Medical Officer for the gastrointestinal business at Medtronic, which is a big medical device maker, as you probably know. So now I juggle two roles. I practice part-time at an academic center here in Philadelphia, and then I'm full-time at Medtronic. And then on top of all of this, I also, play around with social media and am active on all the different platforms as well.
Do you still have free time?
A little bit. I've been trying to, build in more free time because I've realized, that I have to preserve myself in order to deliver for everyone else. So it's definitely a lesson that I've had to learn, the hard way.
All right. So I wanted to read one of your quotes.
Okay.
As someone with a big job but still junior in their career, I feel privileged to be in a position to foster innovation and creativity. How exactly are you fostering innovation and creativity? Oh,
that's a great question. I think part of it is just, part of that statement, being younger and more junior in my career, I bring a bit of a different perspective than a lot of other chief medical officers, I would say, especially at a company of this scale. Often these chief medical officers have a lot of experience clinically, and they're retiring out of their clinical jobs, and they're full professors and very accomplished, obviously. But, I think I am a little bit closer to the trainees, I'm closer to the young faculty, and bring a little bit of a different perspective. And especially with the social media piece, I'm very aware of kind of, what the customers and the patients, may be thinking about and how to get the messaging out to them. And so, a lot of what I feel I do is not just about medical devices, but also the disease states, and really thinking about how to get the message out about the different conditions. And so those conditions affect not only older people oftentimes, but also younger people. And how do we, raise brand awareness among that segment of the population? So yeah, a lot of it is just a matter of like who I am, my experiences, in my career thus far, and bringing that to the table.
That's really cool. And by the way, we are going to leave all the links to social media of Austin, and you can definitely encourage you to subscribe. Really nice and interesting and entertaining content over there.
Thank you.
All right, let's talk maybe a bit about not as fun topic, about US healthcare system. Lots of people think that the system is broken. Would you agree or disagree with that statement?
I don't think that it's entirely broken and not salvageable. I think that there's a lot of perks to it. I actually lived part of my life growing up in Taiwan, where it's a single-payer health system, and I was able to kind of compare and contrast as a clinician what it feels like to work there, just observing as a patient kind of what the doctors are doing there versus actually practicing medicine here. And there's, benefits and disadvantages to both systems. So I see how there's not a perfect answer. Obviously, here we have a lot of challenges here in the US. The pandemic, I think, was a huge example of like all the challenges we face with the public health response, with the culture here, misinformation everywhere, dealing with that, and then also just like how complex the systems are here and the bureaucracy that we have to deal with. So, I think that it's, I agree to a certain extent that it's broken, but, that's where we have to get creative and try to think of ways to improve it.
What top 5 problems would you mention both from provider and consumer side?
I think as a consumer, as a patient, there's so much misinformation, as I mentioned, and I think that that's a huge challenge because part of it is, I think, intertwined with how we are culturally, and the pandemic was a big example of how, we're very individualistic in this society here, and it's harder to rally around, authority and around kind of a common, piece of knowledge. And I also think that part of it is also how we educate people from the ground up. Understanding the scientific process and what goes into science. It's not just pulled out of nowhere. The other thing as a consumer, as a patient, is just navigating the health system is so challenging. There's so many hurdles and barriers. And I think one common challenge for both consumers and practitioners is, navigating insurance companies. And I feel like as a clinician, I can say, I share the same feeling as a lot of my colleagues that a lot of the decision making is out of the hands of the doctors. A lot of it is like we're taught one thing in medical school, and then when we're actually out there practicing, we're told, no, you can't do this because this is what the policies say. And so how do we change that? I think that's another challenge, is that a lot of us feel helpless in understanding how we can advocate and change that process. And I think educating the clinicians on how to change that and how to advocate, how to, just understand how these policies are put in place and how guidelines are formed. I think a lot of doctors out there aren't really taught that through medical school, and just understanding everything around the science is really important. I think medical school, medical education at this point, or training in general, is very focused on understanding the medicine and the science, and that's obviously very important. But understanding the political piece of it, the business side of things, like everything outside of just patient care, I think is equally important. And I think we're beginning to realize that.
Do you think in any of those problems the technology can help to at least improve partially?
Absolutely. And I think that that's the other, one personal agenda that I have, is that now that I bridge the gap between kind of the medical device industry and academia and clinical practice, is to share my insights that I'm learning with my colleagues. Because before I joined, I had no idea what the process was like to take like an idea or an invention to market. And I think my colleagues should understand that too, because they're clearly on the front lines, serving patients, taking care of patients, knowing what the patient's needs are. And so, I think that with their perspective and their ideas, we can really help transform, how healthcare is delivered. So absolutely, I think technology has an important role in this. With how complicated systems are right now, I think there's an opportunity for technology to make our lives more efficient and easier. I feel like there are a lot of examples of this happening outside of healthcare because there's less regulation and maybe things just move faster. And in healthcare, we don't get those, innovations quite as quickly as others.
Yeah, totally agree. Over the past years, what kind of breakthroughs and innovations blew your mind? Not specifically in GI field, but in healthtech or medtech overall.
Oh, even when I think about, there's always a saying in medical school that by the time you're done with medical school, 50% or I don't know what percentage is no longer relevant. And I used to not necessarily believe that, but now that it's been over a decade that I've been out of medical school, and I think back to when I graduated from med school, a lot of what we do, that standard of care, didn't exist back then. I didn't even learn about it in medical school. And so, I think that there's so many different things on the device front, like gastroenterology has transformed tremendously because of so many different types of technologies and innovations, a lot of which, are part of the Medtronic portfolio. But at the same time, there's a lot of advances in pharmaceuticals. When I think about how over the past decade, hepatitis C went from something that was very difficult to treat to pretty much curable. There's also changes in how technology has affected just our understanding of healthcare, like the impact on healthcare, and social media is like a big example of that. So it's not necessarily like a healthcare innovation, but it's totally impacted how, we practice healthcare, how people perceive healthcare. And it's another thing that we have to care about now because that influences what we do now. So, I think health information is one of those things that I've always cared deeply about because of social media. And I think that now a lot more people are paying attention to it because of how we know it, how it shapes like public opinion and public health outcomes as a result of the pandemic.
Okay. Just out of curiosity, have you tried VR, AR headsets, in terms of for work specifically in any way?
Not for work specifically. I am actually not aware if there's anything specifically like in clinical practice, like in patient care, that's approved for use. But we've used it in training. So even on the Medtronic side of things, we have had several types of virtual reality programs to help, people understand how to use the devices and learn more about like the technology. And that's been really fun and helpful. And I've seen a lot of examples of augmented reality and whatnot in at least maybe an experimental setting. And I can see its potential there. I just, I know there are a lot of hurdles to, being able to use that type of thing in real time.
Yeah. Okay. Let's talk a bit more about Medtronic. What is it like to work for such a large corporation?
Yeah, I mean, it's all I know thus far because my only kind of job outside of clinical practice has been this specific role. And I think the culture has been really great. I mean, that's a big reason why I joined, was because I realized that the people there were bright and open and inclusive. And I think the company pays a lot of attention to that. I will say that, because it's a big company, I think everyone has very specific, distinct kind of responsibilities. So unlike a startup where you only have a few employees and everyone has to kind of, fill in the gaps and, figure things out together, everyone has a more defined role within a big company. That said, when I came in, I was the first chief medical officer for our business. So I was given kind of a blank slate with what my role should look like. And I owe that to kind of my, seniors and my boss, for giving me that sort of flexibility. And just, I think it's been a lot of fun discovering what the needs are and then suggesting some solutions to help, fix those needs.
All right. I want to talk to you about Capsule Endoscopy. I feel like it's been there for a while, like for at least 20 years. And since it looks like it shouldn't be like super expensive technology, it should be available all around the world now, but it isn't. Why do you think that happens?
Oh, that's a great question. I mean, I think that, we have like a big command over the market share over capsule endoscopy because we were kind of the originators, like you said, about 20 years ago. Here in the US, it's pretty standard of care. It's built into the guidelines and the algorithms. Like when we're looking for certain things after endoscopy, if we can't find it, capsule endoscopy is the next step. So it is quite well adopted here. I think in other places, maybe, it's just not quite built into the guidelines. Maybe, for other reasons like cost and whatnot, there may be some challenges there. I can't really speak for other regions, but that might be part of the reason behind it.
But again, maybe that would sound not super professional since I don't have a medical background. My understanding is that the capsule usually it goes through for 6 or 8 hours, something like that. So unless the algorithm work fine and they actually point the doctor where the problem might be, the only way for a doctor just to watch the whole 6 or 8 hours and see like by himself or herself, right?
Yeah.
So unless the algorithm don't work, there is no point in the camera, I guess, right?
Well, so with endoscopy, there's only so much of the bowel we can see. Right. So there's like 20 feet of small intestine that we usually can't see. And that's where capsule endoscopy can be really, really helpful. You're right. It is a very arduous process, like reading these studies because it takes a lot of time. And, not all capsule endoscopy systems are created equal. Like some of them have different frame rates. Some of them, are programmed in a way that, take pictures more in detail during certain segments of the bowel. And we have capabilities now where we're able to read the study that doesn't necessarily have to be on-prem, but can be like remotely and through the cloud, et cetera. So like that's these sorts of innovations that sound simple in theory, but when you apply it in healthcare, it can be challenging because operating within this complex healthcare system, dealing with cybersecurity issues and concerns that institutions have can be like a whole nother level of challenges.
Right. Okay. GI Genius. Can you tell us a bit about it?
Yeah, so we're first to market with the first kind of AI-powered polyp detection device. And this is to help doctors spot polyps, which are precancerous growths during screening colonoscopy to help potentially prevent colorectal cancer. And so, when we're doing colonoscopies, like it's impossible to be able to see everything all at once. So this will help prevent, missing those polyps. And we've seen significant increases in our trials with detecting more polyps, and with that potentially preventing colorectal cancer, and with that potentially also saving cost with costly, cancer treatment downstream.
So where the product is now, it's already passed the trials and it's already being sold, right?
Yeah, so it was first introduced in mid-2021. We've already had 3 software upgrades since, incorporating more images to kind of refine the algorithm. We also announced a partnership with NVIDIA earlier this year, where we're opening up the platform, or to create a platform rather than just one kind of specific algorithm, where we're inviting external developers to develop algorithms for other disease states and things like that, and potentially we can host those algorithms on our hardware.
Cool, very cool. Your personal opinion, with all this AI boom after ChatGPT appeared and all this stuff, do you think how it's going to impact healthcare in the nearest future?
I mean, I think that there's a lot of potential impact, like you mentioned, ChatGPT, this sort of generative AI, like there's a whole opportunity on that front. There's also more disease states, like I said, not just polyp detection, but image-based type of AI. And then I think, ways to make us more efficient in healthcare. I think a lot of doctors are waiting on ways that AI can help us, automate certain things that we're doing to help us save time, because that's really a huge challenge in what we're dealing with here in the U.S. healthcare system. So yeah, I think that there's a lot of opportunity, and I know there's a lot of different ways that people are working on this, and so I'm excited to see it evolve, although I know it's going to take some time because it's healthcare after all.
What kind of innovations do you expect in GI field specifically in the nearest future that actually can improve and help your job?
Yeah. I think our main focus right now is definitely in the AI space. I think that, robotics for Medtronic is also a big priority. So I see that there's potential applications in the GI space with that. I would say those are probably the 2 kind of biggest areas in my mind at the moment, at least from a device standpoint. I think on pharmaceuticals, that's a whole different thing. Yeah.
All right. Very cool. At the very end, I asked my guests to give some kind of recommendations or piece of advice to startup founders in healthtech and medtech specifically. What would you recommend them from the provider side? Like, what do you think they should do or not do in order to help you bring some value to doctors, to patients, and everyone who's involved?
Yeah, I think that there's a lot of smart people within tech looking to create new shiny things, and I always encourage people to involve the user and involve the target kind of audience, whether it's physicians, whether it's patients. I feel like we don't do that enough, and so that's part of the reason I think even in my role, what I bring to the table is kind of the voice of the consumer, of the physician customer, of patients to a certain extent, just the understanding of what that, how these devices affect patients. And I feel like there definitely have been moments where I've come across founders who, haven't thought that through, but that's really where my starting point is. And so it becomes very apparent that, maybe the solution that's been created hasn't quite found the right problem to fix or isn't adequately addressing something. So I think having those voices early on is really important. And also like considering these external factors like social media and kind of messaging around that. I think like part of my initial goal, of being on social media was just raising greater awareness about GI disease states. And, I've thought about how that can potentially even drive like, use in some of these devices because of the disease states that we're trying to address. So I think, considering not just like our health system, but kind of all factors around is important. And that's important not just for medical devices and health tech, but also just medicine in general. Like there isn't enough attention on prevention and social determinants of health and all the things that affect people's health and livelihood. And so I feel like that's going to be, the next phase of where we should be focusing on.
I agree. That's really important. There's one more thing I wanted to ask you. I want you to address this to all doctors around the world and ask them to be more active in adopting the technology that appear, because the faster, and the doctors can initiate that process, and the faster we do that, the faster we're going to bring technology to healthcare all around all the areas and fields. So can you tell the doctors, and with your example, how you're involved both in practicing medicine and also being a chief medical officer, why this is important?
Yeah, I think often we complain about why things aren't better in healthcare, but it's really up to us to adopt new technologies and try it out to see if it'll improve, what we're doing here for the sake of ourselves, for the sake of patients. And I don't think, there are a lot of doctors out there who probably don't realize that, is that like ultimately we need to use the new technologies for the whole field to move forward. And I'm not sure like why there's that sort of resistance. Maybe it's just like a cultural thing. Maybe it's built into how we're educated about medicine to always like question things and be skeptical, which it's always good to have a healthy dose of skepticism. Right. But yes, I do think it's very important. And I think it's a great opportunity for a lot of physicians who want to become leaders in their field. If they're early adopters of that technology, it's an opportunity for them to, help develop this next phase of a new technology, to publish on, the use of the technology. I think that I've seen over and over again examples within my field where people have become known, big names in the field, because they are super users of certain technologies. So that early adoption can really make a difference.
Thank you. I think that's really important. And sometimes I think another problem is just doctors don't have enough time. Like just you need to sit down and check the new app that appeared like for a specific disease or something. Yeah. But again, I think you have to find time at some point, because the sooner we adopt technology, the easier it's going to be later on in your career and help patients, hopefully.
Exactly.
So thank you, Austin. That was really a pleasure talking to you. Yeah, really great insights.
Thank you so much for having me. Appreciate it.